You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering a laser hair removal. With us, we have Dr. Ricky. Dr. Ricky, welcome to the
Good
program.
morning. Thank you. Thank you for having me.
Now, I like that you're wearing scrubs today. Is this how you dress every day?
This is how I dress every day. As because I work and I don't wear a tie so much, so I'm comfortable, and this is what I wear. So
all right.
when you come and see me, this is what I look like.
Now, before we get into today's topic, and I know you have mostly women going to you for hair removal, you're an OB/GYN.
That's
that right?
correct. Yeah, my first part of my career, formal training, is OB/GYN, and I did that for several years. And then I self-trained to be a bariatric physician, which is medical weight loss. And I kind of graduated into that and helped women and men lose weight. And then in the third part of my career, I actually got into the beauty concerns of women and men because the technology started to change. So now they were worried about their aging, they were worried about unwanted hair and lines and wrinkles that didn't go away, and so I actually trained myself to do that. So I've had actually kind of 3 careers in one lifetime.
All right, and I took a look at your book. You wrote it's a nice looking book, by the way. The Little Book of Beauty, The Thinking Woman's Guide to Health and Beauty. We're talking about hair removal today. And why'd you write the book, by the way?
I basically, women wanted to know, is basically as a public service to educate people. The book was written in 2 parts. The first part was all the beauty treatments that you don't need a doctor for, kind of like a holistic things that people can do.
All right.
The second part explains the technology, because there's a lot of technology, a lot of dermal fillers, a lot of new products, and chapter 11 was how to choose the right doctor.
It was good. It's very, very nice. Well done. So let's talk about hair removal. I mean, how big of a business is hair removal?
Well, it's actually the #1 non-surgical cosmetic treatment performed in the United States.
Is that right? Really?
Yeah, there's hundreds of thousands of these treatments being done. And there's the reason for that is that, what women tell me, I've been around women my whole life, they hate tweezing and they hate waxing their hair, and they're especially on the face, they're self-conscious about it, so they tweeze and pull that out, and every time you tweeze a hair you take out a little piece of skin with it, so sometimes they'd have little pock marks where they've been tweezing all the time. And I asked them, I said, well, why don't you just shave? I mean, I've been shaving for 40 years. And they were just appalled by shaving their face for some reason. And me as a guy, it didn't make any sense. I've been shaving my face for 40 years.
But they don't want it to get thicker, obviously.
They think it's going to get thicker for some reason. I said, well, that's not true. I said, if it were true, men would be like gorillas. I've been shaving for 40 years. I said, you don't have any trouble shaving your legs or your arms.
But you're not endorsing it on the face. I mean, you get that zapped with a laser nowadays.
You can, and that's what it's for. But I was just listening to women, what they would tell me. I said, well, why are you here? I said, well, I hate waxing and I hate, tweezing, and I'm not going to shave.
Now, from what I understand, that over the last 10 years, huge differences, improvements in laser hair removal. In fact, even in the last 2 years. I mean, is that correct?
Yeah, the last 3 or 4 years, actually, the second generation lasers have come out. The first generation had a laser only, and that was a delivery system for heat, which sure beat shaving, plucking, or even electrolysis, which hurt. And so the delivery system was a laser. Now, 2 problems with that first generation. You had to use very high power to get enough heat down to the hair follicle, and of course that hurt. It felt like a hard snapping rubber band.
Is that right?
And the second limitation is that it took a long time. These machines generate a lot of heat.
It's like a 2-hour procedure in the old days.
It used to be, it'd take 6 seconds or 3 seconds to recycle from one pulse to the next. And a back would take 2 hours. And you have to charge a lot of money for that.
What about now?
Now it's quicker. Now it's 6 times faster, the second generation machines.
15-minute treatments?
Yeah, 15 to 20-minute treatments. So it doesn't take as long, so that's how we can lower the price.
Like a whole back could be like 15, 20 minutes.
15, 20 minutes on a whole back.
Right?
And it doesn't hurt.
Okay, because you're a medical doctor, you could apply numbing cream or things like that. Is that right?
If we need to. Most people don't need to because the treatment doesn't hurt. And here's why. When you have 2 power sources rather than just one, you can lower the power because they act together synergistically. Kind of like 1 + 1 = 3, I say to people. So that allows us to use lower power levels, which do as effective as the first generation machines without pain. Now, occasionally some people are real sensitive around the bikini area or underarms, and so we do offer a topical anesthetic, and we don't charge for that.
Does it work, though? See, that's what I hear. I know women, I've asked around, everybody I know, I guess they're waxing. So my question to you is, does it work?
Yes, it's very effective. And this is why people spend, well, like in my case, $90,000 for a machine. I wouldn't have bought it if it didn't work.
Okay.
And it does work.
So is that the perception, though, that it doesn't work? You think that keeps a lot of women from doing it?
I'm sure that there's some people have tried it once or twice and didn't see the results they were expecting, then kind of gave up on it. You have to kind of keep going it because the hair comes in spurts and growth cycles. So it's not a one treatment protocol. It's several treatments. And we have people come in about every 6 weeks. We evaluate them. And actually what we look for are little bald spots that don't grow back. And that's how you can tell that you're making progress. So some people, I think, give up too soon.
Now, on the phone, you said something very interesting. I said, what about price? You go, I'm the least expensive in San Diego. Is that right?
That's right. And that's intentional, because this doesn't take as long as it used to. Rather than taking an hour and a half or 2 hours for a man's back or, 30 minutes for a bikini, it's a sixth of that. So the price comes down accordingly. And
so it's more than half off.
It's more than half off.
70% off of what it was 2 years ago.
Absolutely. And with the economic times, people are pinching pennies and they're not spending money like they used to. So we want to make this more reachable for people, not just people with, money. Just the average person.
Now, waxing. Is that the number one way women, and we'll start with like bikini area, okay? Popular area. Very painful. Is that right?
Well, I've never had it done. I don't think I'd like to have it done.
But this is what
Pull
they
out
say.
that hair like that.
But this is what they say.
This is what they say.
Okay. And it's expensive. So what's more expensive in the long run?
Well, the situation with waxing is that it's effective in pulling out the hair. The problem with it is temporary because the hair grows back. You're not destroying the hair follicles. Where with the laser and our treatments, we're actually destroying hair follicles, so it's a permanent reduction. They don't grow back forever, and it's long term.
So with those hairs that are hit and targeted, they're killed.
They're killed.
So they don't go back.
We damage them. We persuade them not to grow back anymore, and all these little bald spots start to collect until the area is much less
3
dense.
to 6 treatments, and you can effectively hit an area and get it over with.
In most cases, yes. Some people require a little bit longer. And what the correlation is that the higher power we can use safely, within reason, the more effective it is.
So if it's as good, though, as you say it is, and more effective than waxing, and I don't think you'll ever meet a woman that enjoys being waxed, okay? Why aren't they all doing it, though? What's your take on that? Help me understand that.
Well, when I talk to the women, I ask them that. They said, well, a lot of them have concerns that, number one, it doesn't work. Number two, it's too expensive because they remember the prices that used to be 2 and 3 years ago. They also think that if they do laser hair reduction, that it hurts, and it doesn't. And also there have been concerns about, well, when the first generation machines came out, you couldn't use them on darker skin.
Like Asian, Hispanic,
Filipino women, because the pigment in the skin would compete for the heat with the pigment in the hair follicle and tend to burn them.
Well, that's still the case, though, isn't it?
It's still the case if you have an older generation machine.
Oh,
the new generation machine bypasses all that because the addition of radio frequency. Radio frequency is colorblind. Doesn't care what color your hair is. So we lower the laser and raise the radio frequency portion so it's effective on darker skin.
Now, help me understand this part. Okay, so I've had other doctors talk about radio frequency for other things. How does radio frequency get in there and damage the hair follicle or kill it?
It's a heat treatment.
Oh, okay. So it's the heat that
It's
kills
the heat. See,
So blonde hair can be treated then?
Yes, it can. Also, white hair, red hair, hair that doesn't have pigment in it. The laser doesn't work on it so well, but the radio frequency does. And that's why these machines open up all kinds of doors for people that were excluded before in the first.
What about burning? I hear. Look, I read a lot of information. That the darker skin, the problem with the hair removal is it burns the skin. That means you get discoloration in the skin, patches of, pigment changes.
Well, that in our hands, we don't see that because it's either a medical doctor doing this treatment and myself or a registered nurse. In California, you have to be one or the other. These treatments are professional treatments. In the wrong hands, they can cause harm. Is
that a lot of that older technology?
A lot of the older technology. Still have to pay attention to the newer technology. There is a learning curve with this, and it really belongs in the hands of professionals.
It's tedious work. This is what doctors tell me. And I've asked other doctors to come on the show talk about hair removal, and they don't want to do it. They say, I don't want to be stuck doing that all day long. Why do you like it?
Well, number one, it works. And when people come in I provide a service, and the service works and people feel better. And the reason that they feel better is that they're not so self-conscious as they once were when they came in. So it's very gratifying for me as a healthcare provider to really have people feel better and look better.
What do you say to the person watching this? We're going to take a break in a few. They're waxing and they're skeptical, whether or not this is, less, because you say it's less expensive than waxing. I mean, per treatment, it's less expensive, right?
That's true.
I mean, is that right?
Waxing is $75 to $80 a treatment, I'm told.
Okay.
And you have to keep doing it forever, 2 or 3 times a year, where with a laser, we charge currently $50 for the same area. And
they're killing hairs every time they go in.
And they're killing hair, and, within a year and a half, you're done. You don't have to do that anymore. Stop paying for it.